Well, my name is Dr. David Brown. I've been with Southern New Hampshire for about 6 years now, on part-time basis as an adjunct faculty in the in the community health and public health program in general. In my day job currently, I work for the network of the National Library of Medicine in Region 4, which is a 9-state region stretching from Arizona and New Mexico in the south all the way up to Idaho, Montana, and North Dakota in the north. And I am the public health engagement specialist for that region. So my job is to make sure that people are getting information for public health, resources for public health and the like. I do a lot of traveling, I do a lot of engagement, and then really just try to get people information and basically let them know that our services are available for free because we're part of the federal government, one of the subsidiaries of the National Library of Medicine, which is one of the 20 subsidiaries of the 27 institutes of the National Institutes of Health. So a typical day with my public health engagement is as part of our program, we do a lot of funded awards for organizations and places, usually libraries, but also community-based organizations and public health oriented organizations in general. And so a typical day, I'll contact one of our funded award projects, see where they are, make sure they're getting everything they need from us so that they are meeting the standards to meet the standards to spend down their money, but at the same time be on track to meet our reporting requirements. As again, part of the National Library of Medicine, we have standards in that area. I will typically attend other outreach and engagement meetings with different professional organizations in the field of public health, in the field of library science, in the field of medical librarianship as well, and really just trying to let people know that we're here, what products and services we have, what courses we offer, what continuing education programs we offer, and really doing that. And that's a typical day. On extended days, I will be traveling. Like I say, there's times where I'm on the road for 4 weeks straight, going to conferences, going to my different states, engaging with people, because unfortunately the way this falls is there's usually a lot of travel in the fall and a lot of travel in the early spring, and then it's quiet for the rest of the year. But that's just the way that typical day or that typical week works for me in a general experience, is to be open to learning and engaging with professionals in your field. The nice thing about public health and health education, health promotion, it's a newer field. It's not that old, and a lot of the people are still alive. And if you send them an email, they will respond to you. So if you have a question about a theory or a model, get out there and talk with them. Get to know who they are. Always look to increase your network. Try to get involved with a professional organization in either health education or in public health, and really just try to use those resources, because again, it's not necessarily what you know, it's who you know and how you can get into those positions to actually use your education and move on. Because while there are more jobs in public health now, it's still not as well funded and as well respected as other things. So yes, you're getting the degree, but at the same time, you do need to be looking at creative ways to engage in public health and be open to how do I get a job in this field that I am studying or spending my undergraduate education or even my graduate education in, so that I can be successful as a public health practitioner moving forward.